What's up, everybody? We all get headaches once in a while, but are you getting them more often than you would like? Are your headaches starting to interrupt your daily life and the things that you like to do on a daily basis? If your headaches are starting in your neck, coming up the back of your head, around the side of your head, and are focused kind of behind your eye or on your face on one side only, similar to this picture here, as we can see it coming up the neck, starting in the muscles, referring to the back of the head, around the ear, and then focus more behind the eye and on the face. Maybe you also have pain when you turn your head to one side. When you turn your head to one particular side, no problem. You can turn around and you're practically an owl. You turn to the other side and you either can't go that way, it's blocked, or it hurts, and you start to feel that headache coming back on. And you might even have some weakness in your shoulder down into your arm. If any of these symptoms apply to you, you might have what's called a cervicogenic headache. We need to first screen out more worrisome conditions involving the head and the neck, but there's a good chance that you're going to fall into this category. I'm Dr. Jake Shockey, a chiropractor, and let me explain to you a little bit more about these pesky headaches, how to know if this is you. So, cervicogenic headaches, what does that even mean? Cervicogenic headaches are usually caused from a dysfunction involving the C1, C2, and C3 joints and nerve complexes that are involved. They're going to often refer pain in kind of a random pattern, but is always going to be one-sided only. If you have pain on both sides and you can feel your headache on both sides, this is not you. Now, a specific cause of a cervicogenic headache is a little bit harder to figure out. Most of the time, there's not one specific cause. However, the joints between the C2 and C3 vertebra, so between this one and this one here, where they connect at the facets, that is oftentimes a contributing factor, especially if you've had a previous whiplash injury. Now, some of the symptoms we've already talked about: range of motion loss in the cervical spine. So what that means is when I turn to my right, I can turn around and basically I'm an owl to the right. When I turn to the left, I'm going to get stuck and I'm going to say, ow, that hurts. The muscles are tight. I'm getting pain into my head or to my face when I turn my neck, and I just can't turn around like I can when I go that way. So I'm also going to have increased muscle tenderness in the same side. So if my issue is on the right, I'm going to feel muscle tenderness on the right. So just touching some of these muscles is going to be tender, starting in the neck and then coming up behind the ear and the back of the head. You can start to feel some tenderness. If this is you, you know what I'm talking about. This can be caused from any type of neck trauma in the past, whiplash injuries, chronic strains or trigger points located in the cervical neck muscles, either in the front or the back or in the back of the head in our suboccipital regions. And usually those can be brought on by exercise or postural habits. So I'm talking to you sitting behind the computer all day long, or those of us on our phones, on reading books all day long. That becomes us because of our posture. We have certain muscles that are overactive and certain muscles that are underactive, leading to trigger points and pain in the neck. Now, this kind of headache can last you for an hour. This headache can last you for all the way up to a week. The feeling is going to be a dull, throbbing kind of pain that's going to start in the neck and then kind of go up, 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 and then into the head, and can eventually get around the eye and to the face due to those nerves because of where they travel. Now, what can a chiropractor do for you here? This is very often a conservative care case. This doesn't need medication. This doesn't need any type of surgery. It's conservative care. So getting with your chiropractor, coming into my office, talking about your symptoms, the pain patterns that you're feeling, time frames for what you're feeling can often help us get to the bottom of this, identify the fact that you might be suffering from a cervicogenic headache, and come up with a treatment plan individualized for your symptoms and your lifestyle. What is it going to start with, and what is our treatment going to revolve around? Well, we're chiropractors. Our main tool is the chiropractic adjustment. With this type of headache, most of the symptoms are starting because of a blockage or restriction in our upper cervical spine. Our upper cervical spine, between our skull and our first vertebra, is going to be responsible for about a third of our entire neck's flexion and extension. Then between the first and the second vertebra, we're going to basically account for up to 60% of our cervical spine rotation from side to side. So if you're blocked in one of those two joints, or even like we talked about earlier, between C2 and C3, you're going to end up with some of these symptoms that we're talking about. And if it's chronic enough and we let it go on long enough without seeking treatment, we're going to end up with cervicogenic type of headaches. So chiropractic adjustment is going to be perfect for this patient. If this is you, you're going to be lined up for a cervical adjustment to increase the amount of motion that we are getting in these joints and hope to make it symmetrical side to side. Next, with this newfound range of motion that our body and our brain is not used to, we need to rehab. We need to strengthen the muscles around the joints, and we need to teach the brain how to use that newfound range of motion. So our rehab is designed around stability. Our adjustments are designed for mobility in the joints. So we mobilize them with the adjustment, we come right behind it with some rehab, and we stabilize that joint, making it strong and stable. We're going to also incorporate some rehab to strengthen our deep neck flexors to be able to keep our head up and back, especially for you sitting behind a computer or that are looking down. Don't feel bad. The majority of Americans fall into this category because of the lifestyle that we live. So, lastly, another really profound treatment that we have found is using trigger point dry needling to get rid of some of the neurological tension that is balled up inside of our muscles and creating some of the restrictions that we have in a muscular form. The end goal of all of our treatment is going to be restore proper function. So even if you are without pain, we still need to hammer proper function. What do I mean by proper function? I'm talking about proper posture and being able to maintain that posture. I'm talking about range of motion in all of our joints, being able to look up, down, side to side, laterally flex our head both ways is going to increase the function. Getting rid of all trigger points and strengthening the muscles that need to be strengthened and stabilizing the muscles that are meant to be stable for our neck and our head and our shoulders. So if we can restore this function, the whole package, we are then going to give you, the patient, the power to be able to get rid of this cervicogenic headache and keep it away. So if any of this applies to you, you have more questions, you're feeling some of these symptoms, give us a call, get in, let's get scheduled, let's sit down, let's talk about what it is that you're feeling and what we can do for you. See you next time.